Right at the top of the hour, and we'll get ready to start. Hello and welcome. My name is Anafi Mataka. I'm from ASLM, and I'm delighted to be your moderator today. Welcome to the May 2020 Waste Management session. Traditionally, in partnership with the CDC, US CDC, these monthly sessions have started with a focus on viral load EID testing. We have evolved over time thanks to partnership with other key international organizations, fellow countries, organizations such as Global Fund, CHAI, UNITAID, and largely IDC, Integrated Diagnostic Consortium partners. We continue to expand these sessions and view waste management as health systems issue. In today's session, however, we want to focus possibly on what people have arguably called the biggest global health challenge that we have faced in the last 100 years, that is COVID-19. And as you know, the mantra has been test, test, test to control the pandemic. But just like what we're doing with viral load EID, that means more testing and more waste being produced. A few weeks ago, also, the Africa CDC launched PACT, which also aims to increase the number of COVID-19 tests in Africa alone to be over 10 million, I think, now in a short period of time. A significant proportion of these have been molecular testing, and certainly we'll be worried the way we have been worried like HIV. However, the focus today is not solely going to be on waste management. We have concerns that COVID-19 has resulted in more and more molecular labs being established. Indeed, some of these are new, some of them are quite experienced. However, given the large volume of testing and attention to biosafety details that may be required, we feel this is an opportune time to speak about laboratory biosafety guidance with respect to SARS-CoV-2, the causative agent for COVID-19. As usual, this will be a 1-hour session made up of a presentation about 20 minutes long and followed by a question and answer segment. We kindly remind you to enter your questions and comments into the chat box and we'll address them after the session. Allow me to introduce the speaker for today, who is Mr. David S. Bressler. Mr. Bressler holds a master's degree in virology. He joined CDC, US CDC in 1995 after beginning his career as a laboratory technician at the US Army Medical Research Institute for Infectious Diseases, where he studied the diagnostics and pathology of viral hemorrhagic fevers and has participated in several outbreak responses activities such as those for Ebola. And he also supervised the activities for training personnel in the maximum BSL-4 containment laboratory. Since then, David has served as the senior laboratory inspection leader for the CDC Select Agent Program, which ran from 1999 to 1993, as well as lab technical advisor, team leader for the laboratory response team from 2003 to 2011. Whilst at the LRN, he developed and evaluated BSL-3 and BSL-4 biosafety training courses and interacted with laboratory directors worldwide to improve laboratory biosafety, as well as response to outbreaks and bioterrorism events. He has also worked with various state and local public health laboratories, as well as high containment research laboratory community to develop and deliver timely and unique biosafety training. At the present moment, David works for the CDC Division of Global HIV and TB at the International Laboratory Branch, ILB, where he is managing numerous international biosafety and laboratory system strengthening efforts across Africa. He is a certified biological safety professional and a member of the American Biological Safety Association. Ladies and gentlemen, let me hand over to David to take us through the presentation today.
Well, thank you, Anafi. It is a pleasure for me to be here. Good morning, good afternoon, good evening to everybody on this special LabCoP session. As Anafi mentioned, what we're experiencing is something that is unprecedented. We have never been or faced a situation, a disease outbreak or pandemic situation as we're experiencing right now, something that basically has shut down the whole world basically to try to deal with this. So we thought that it was important to kind of put out to the laboratorians, our PEPFAR supported countries, some basic guidance on biosafety. We understand that people may be pulled in to support the response for COVID-19 disease, and we want to at least be out in the forefront and get some basic information about how you would handle specimens in the laboratory if you're called on to do that. And so what I'm going to attempt to do is I will try to cover the guidance from both CDC and WHO during this presentation. And I also try to note where there may be some seeming differences in the guidance, although I think that as we go through this, you'll see that both the guidance from WHO and CDC are pretty well aligned. With that, next slide, please. Okay, so here we have our standard disclaimer. As we are all fully aware, the COVID-19 disease situation is extremely fluid at this time. And there are updates and new guidance and new facts and new research and new information continually being published. Basically every day something new comes out. This is the most up-to-date biosafety guidance for SARS-CoV-2 as of today, 7 May 2020. Next slide. That are important to know regarding handling specimens and things like that. We'll talk about risk assessments, etc. We'll also touch upon some important viral characteristics that sort of has importance regarding the biosafety when dealing with SARS-CoV-2. We will cover the current biosafety guidance put out by both CDC and WHO. And as a conclusion, and relevant to the importance of doing a proper biological risk assessment for your laboratory, we will briefly cover some of the concepts of doing a biological risk assessment. Finally, I will touch upon some of the biosafety resources that have come out and been made available by not only WHO and CDC, but other partners in that have a good background in the knowledge and understanding of biosafety and are applying it to the response effort. Next slide. Okay, so here are a few of the definitions that we want to make sure everyone understands. First and foremost, biosafety is really the application of the knowledge, techniques, and equipment to prevent personal laboratory environmental exposure to potentially infectious agents. What we're trying to do is protect you as laboratorians. We're trying to protect your families, keep them safe, as well as your communities. So that biosafety and performing proper biosafety risk assessments all have this important function. Coronaviruses, basically spherical enveloped positive sense single-stranded RNA viruses, and they have these little club-shaped glycoprotein projections that give the appearance of a crown, and that sort of gave the moniker coronavirus to the coronavirus name. Infection prevention and control. Now, we're not going to be discussing infection control very much in this discussion, but I think that there is a distinction to be made between infection control and biosafety. When we speak about infection control, we're really trying to prevent the spread of infections in healthcare and other settings. Now, the two sort of overlap in many cases, but infection control is mainly for healthcare settings and not laboratories. Disinfection is chemically or physically removing the labile vegetative forms of any pathogenic organisms or multiple organisms. Risk assessment is the process of identifying potential adverse events associated with handling a specific pathogen. And in this case, obviously SARS-CoV-2, which includes the probability of occurrence. So you're trying to reduce any possibility or probability of something bad happening. And you're also trying to reduce the severity of impact on human health or the environment. We will discuss this in more detail later, but standard precautions, it's important to know what they are. Basically, this consists of hand hygiene, the use of personal protective equipment in the laboratory, such as laboratory coats or wraparound gowns, hand protection, gloves, as well as eye and mucous membrane protection. And again, we'll talk more about that in subsequent slides. Next slide. Okay, thank you. Back up one. Okay, great. As a distinction, COVID-19 is actually the disease which is caused by this new or novel coronavirus, which has been named SARS-CoV-2. Coronaviruses are found commonly in both people and animals. Camels, cattle, cats, and bats all have their individual set of coronaviruses, which they carry. They are, they are mainly transmitted by infectious aerosols and droplets landing on mucosal surfaces. Really, coronaviruses are a very large family of viruses, and they do cause illness in people, and others circulate among the animals. Several known coronaviruses infect people, and basically they usually only cause mild respiratory diseases such as the common cold. However, at least 2 previously identified coronaviruses have caused severe disease, one of which would be SARS coronavirus, the first one that we discovered, and back in 2003, I think it was, and MERS currently. However, neither SARS-CoV or MERS are causing the current outbreak. So those 2 viruses are not causing this outbreak. This is a newly discovered coronavirus. Again, transmitted by infectious aerosols and droplets. They replicate usually in epithelial cells, and they cause short-term cell damage in the lungs and intestinal mucosa. However, what we're seeing in some cases is that the cell damage that is caused by the infection can release inflammatory mediators, and this causes, for at least in some individuals, this can cause something referred to as a cytokine storm, and that can cause more serious complications like the fluid release into the lungs and what appears to be other interesting sequelae from the disease. Let's see. So most of our laboratorians are extremely skilled and competent when dealing with bloodborne pathogens, but this is the reason that we think that, you know, it would be good to have some background for our people on an aerosol. aerosol spread disease. We deal with bloodborne pathogens every day. HIV, hepatitis, and even Ebola have been dealt with by our lab folks very successfully. However, we have to acknowledge that we may not always be aware of the best practices for avoiding infection by aerosol spread diseases. These are the best microbiological practices. PPE and engineering controls are what we'll try to cover today to arm yourself with the best information available when you're working in a laboratory. Next slide. Okay, great. So we have up here the latest guidance. These are both put together in March. So it's the most recent guidance that we're aware of from both CDC and WHO. You can see that CDC labels its guidance as interim laboratory biosafety guidelines for handling and processing specimens, and WHO labels theirs as laboratory biosafety guidance related to coronavirus disease. I have included the links not only in this slide but also in the resources slide. Both guidance specifically cover the lab operations of many types, from types of PPE to consider, the different types of containment operations, specimen handling, and shielding in non-containment conditions, which we'll talk about, like benchtop and in resource-constrained situations that may not have access to a certified biosafety cabinet. So we'll talk a little bit about that as well. CDC also has published a quick go-to frequently asked questions page that covers some of the more specific questions that have come into our Emergency Operations Center, and that link is also provided in the resources slide as well. Next slide. Okay, so here's where we get into the real nitty-gritty. So for risk, let's see, I think that it's probably a good idea to, at this point in time, say that the biosafety aspect of all this is important throughout the life cycle of the specimen, regardless of what it is. This would include the shipping regs that are used to get the specimen to your laboratory, to receiving the specimen into your facility, and transport even within your facility using good practices. So from everything from accessioning to manipulation to waste or the final disposition of the sample, all of this means that good biosafety practices are paramount. Let's see, so in addition, appropriate training is something that's critical. We need to make sure that our personnel are competent, trained, and have the skill set to deal with this sort of thing. And so the competency in training is critical. For your laboratory work, where you may be requested to work with suspected positive COVID-19 patient specimens, you and your lab staff and leadership should begin by performing a site and activity-specific risk assessment before opening the first specimen vial. Look at all the procedures you are going to be doing, everything from opening the vial to pipetting or mixing the sample to type of work material that you're going to be dealing with, and the materials that will be generated from that as well. You want to be really as thorough as possible, taking into account the training and competency, which we already mentioned, the equipment that you'll be working with, whether it's a biosafety cabinet, centrifuges, etc., and what available resources that you have. Things like PPE, do you have appropriate disinfectant and things like that. Standard precautions should always be used when handling any clinical specimens, and the standard complement of personal protective equipment should be LabCoP or gown, whether it's wraparound or not, gloves, eye membrane protection, face shield or splash shields. And basically one of the biggest things is to routinely disinfect your work surfaces with appropriate disinfectant, and practicing good management of laboratory waste will save a lot of trouble. Next slide. Okay, so for routine diagnostic testing, what we're talking about is that you'll be working in Biosafety Level 2 laboratory, and which is the standard type of laboratory which most of our folks are affiliated with. And we would be following standard precautions and things like using automated equipment, instruments and analyzers, processing the initial samples, staining and doing microscopic analysis of fixed smears, things like TB smears and things like that, examining any bacterial cultures that are associated, pathologic examination and processing of formalin fixed or any inactivated tissues, doing molecular analysis or nucleic acid prep, whenever you're packaging or opening primary containers to get the samples out, make sure that you decontaminate properly. Using any inactivated specimens, such as specimens for nucleic acid that have been suspended in nucleic acid extraction buffer, and doing any sort of EM with glutaraldehyde fixed grids. This list is not exhaustive, and it may or may not apply to your own laboratory, but these are the things that we wanted to list out. Let's see. So remember that we're talking about, for standard precautions, basically handling any laboratory specimen as a potentially infectious sample. Standard precaution is providing a separation between you and the sample and any possible aerosols or droplets that may come from that sample. So this is what we're talking about: primary containment, providing that separation, whether it be a shield or whether it be the biosafety cabinet, or even making sure that the cap is securely tightened on that vial. That is really what we're talking about when we talk about primary containment. Next slide. Okay, so this was something that we really want to discuss, because decentralized and point of care testing, which is really picking up speed now, but the caveats that come with this are that these locations where this is done may or may not have all of the infrastructure that would be associated with using these types of things. And so for point of care testing, we may be talking about minimal infrastructure. There may not be a certified biosafety cabinet available, maybe no autoclave and limited supply. So the idea is to create really a barrier, as we mentioned earlier, between the specimen and you who are handling that specimen. So we want to make sure that we're talking about standard precautions, barrier protection, flat splash shields, things like that, mucus and eye protection. So in this slide, it's a little bit nuanced. CDC guidance is a little bit different from the WHO current recommendations. CDC gives that face shield, sample splash shields, and additional PPE along with good practices should be used. WHO doesn't quite get into the weeds as much, I think, for this one, but we want to make sure that everyone is aware that if you don't have these, have the equipment like the certified biosafety cabinet, which you may not have in a point of care testing location, that you can do adequate prevention, adequate safety by using barriers, by using the splash shields, by using more or additional PPE that will protect you from creation of aerosols. Good airflow in the laboratory or wherever that testing is done is also important, as it basically diffuses infectious aerosols and things like that. What are we talking about? The big thing to keep in mind that basically anything that we do with a sample has the potential for generating infectious aerosols. This includes mixing the sample as the initial step, centrifugation, pipetting, vortexing, mixing, shaking, removing caps, aliquoting specimens, filling specimens, or even cleaning up spills. All of these things have the potential to generate infectious aerosols, and it's important that you be prepared to deal with this either through administrative controls like a standard operating procedure, and then having the PPE on hand to utilize for that. Let me see. I think that let's move on from there. Okay, so what are we talking about? Just to cover this a little bit more in depth, in situations where there could be a very high likelihood of generating droplets of aerosols, we either need to use a certified Class 2 biosafety cabinet, or if that isn't available, using additional precautions, just like we mentioned. The additional precautions can be surgical mask, although that surgical mask will not prevent you from breathing in aerosols. The standard recommendation would be for at least an N95 respirator that you have been fit tested for. In addition to that, a face shield to prevent splashes or aerosols getting to your eyes. Physical barriers such as a splash shield between you and where you are handling the specimen can also reduce the potential for splashes and aerosols to the face or mucous membranes. In addition, goggles or safety glasses with splash shields or sides and vents that prevent droplets from getting into your eyes, but also a vent that allows air circulation behind, so that your goggles do not fog up. When you're wearing all of the PPE and things like that, comfort is paramount, because if you're not comfortable, you can have accidents. And so one of the things, if you can't see through your goggles or your face shield, something is wrong, and it's important to pretty much stop what you're doing so you can take care of the problem first before you go back to the specimen. That will reduce the potential for a laboratory accident. Make sure that you're utilizing centrifuge safety cups. These are the plastic caps that go onto the safety cups. If a centrifuge tube breaks while it's being spun down, you can always then open the container within a biosafety cabinet or other primary containment area. Utilize sealed centrifuge rotors as well. I think that's it for this slide. Let's move on. I'm going to move a little bit faster here because I think that it's important, and I am spending a little more time. I'm hoping that that's okay, because I think that a lot of the information for our own laboratorians that are used to dealing with just bloodborne pathogens, this is useful information for those who may be in a new experience at this point in time. So most of our PEPFAR supported HIV labs will not be doing any sort of virus isolation or culture or amplification of the virus. However, I think that it is important that you are aware of what would be done if you were in that position. So for laboratories that do this type of work, a BSL-3 laboratory, utilizing BSL-3 practices and the laboratory infrastructure would be one of having directional airflow into the laboratory from clean to dirty at that point in time. So that's one of the major configurations for a BSL-3 laboratory. You would do that for any virus isolation in cell culture or initial characterization of viral agents that would be recovered in specimens. And again, we keep repeating this, but a site and activity-specific biosafety risk assessment is important to be done. For most of the laboratories, the infrastructure necessary to support these types of lab operations would be available. And again, we covered the directional airflow. Often there will be a higher level of PPE requirements and N95 respirators, or even things like a powered air purifying respirators, where filtered air would be delivered to yourself through that system. Next slide. Decontamination. Again, we mentioned how important this is. CDC guidance is basically for decontaminating work surfaces that disinfectant products that are registered with the United States Environmental Protection Agency would be used. The EPA is the agency that is responsible for testing and validating the efficacy of disinfectants against certain microorganisms like TB or SARS-CoV-2 in this case. For the WHO guidance, it's a little bit less detailed. Their guidance is to use disinfectants with proven activity against enveloped viruses such as hypochlorite, alcohol, hydrogen peroxide, quaternary ammonium compounds, and phenolics that would be used likely against TB, things like that. So no specific direction to that, but what you can do is look at the manufacturer's guidance on the label. And to go to you can also go to the EPA. I did not include the EPA link to this, unfortunately. So if there are people who are interested in that, we can follow up with that information. Remember to use the manufacturer's dilution guidance and the proper contact time and safe handling procedures when mixing and using the disinfectants. Next slide. Okay, so another important topic in sort of finalizing what happens with a specimen: laboratory waste management. There's really no discernible difference in the research so far that's been conducted with SARS-CoV-2 to indicate that there's anything special to be done with waste management. So what we're talking about is if you're getting rid of laboratory waste from out of the biological safety cabinets, it should be handled just the same way as you do with any other waste coming from the laboratory. Spray it down, put it into autoclave bags or whatever your system is for handling waste out of the laboratory. Normally, all of that laboratory waste would go to the autoclave bags and into an autoclave. So there's no evidence suggesting any additional packaging or disinfection procedures would be necessary for work with SARS-CoV-2. Now, I will say that what we've been looking at recently with viral load and EID and has special impact for this waste management LabCoP is that, excuse me, is that some of the molecular assays utilize guanidinium isothiocyanate, as we're all aware. In the case of SARS-CoV-2, Cepheld GeneXpert cartridges do contain GTC, and so the recommendation would be that high temperature incineration be used to thoroughly destroy the cartridges along with the chemical. And so that means having a high temperature incinerator available in some way. This may not be available to everyone. So that's something that still needs some input to try and decide how to really handle that. And unfortunately, I don't think I can give much further guidance beyond that. But for those who are interested, I have included the link to the Cepheld safety data sheet in the slide notes. Next slide. Okay, so finally, in the life cycle of the specimen, there may be a need to pack and ship samples off to another lab or research colleagues as that may arise. So for that, there are some differences between WHO guidance and the CDC guidance. So in recommending this, we would probably direct to the IATA dangerous good regulations. In that case, patient specimens from suspect or confirmed cases should be sent or packaged and transported as UN3373, which is biological substance category B. And the note there, anyone packing or shipping patient specimens must be trained in the regulations for Division 6.2 infectious substance transport. Now, patient specimens are different from viral cultures and isolates. Viral cultures and isolates should be transported and packed as Category A 2814, which is infectious substance affecting humans. And again, all personnel involved in the packing process must be trained and competent. And that really falls upon the facility to ensure that that is the case. Next slide. Okay, so I just want to talk in our last few minutes about the risk assessment. A risk assessment really helps in the whole biosafety process by developing means to protect the worker and their colleagues and families against infection. It's important, as has been mentioned, that a site and activity-specific risk assessment is done to determine any additional biosafety precautions that may be warranted for each situation. Now, what I've projected there on the slide is what has been linked into the WHO biosafety guidance. They actually provide a risk assessment template in Annex 2. And so we provided that there, and you can follow that and find that in the link. However, I do want to mention that APHL, the Association of Public Health Laboratories, recently conducted a free seminar on risk assessment for COVID-19. And I would encourage you, since it is a free resource, it's open. I don't know whether you have to register or not. I think you may, but it is a free resource, and they spend a lot of time going through the situation. And if you need additional information on how to conduct a risk assessment, I would encourage you to take a look at that. The previously recorded information is available, and again, the link is provided. Next slide. Okay, so the background on risk assessment is that basically biosafety is an inexact science. There are so many systems and things working together at the same time that it is hard to keep track of all of the potential hazards and things that you may need to do. This really, to me, gets across the importance of doing your own risk assessment and taking into account as many considerations as you can. So SARS-CoV-2 is a very labile organism due to its envelope, lipid envelope. But that's kind of countered by the fact that it is an aerosol transmission factor for this virus, and it makes it a challenge to work without additional precautions. So that's why we recommend the PPE and the biosafety cabinets, etc. You should consider all of the issues that you can think of from the characteristics of the microorganism that you are working with. Consider the limitations and positive aspects of your laboratory. Is there a certified biosafety cabinet available? Is there a validated autoclave? Is there the ability to separate activities and provide a location for donning, which is putting on, and doffing, which is taking off personal protective equipment? Are the hand washing sinks in order, and is there soap available and paper towels? Just little things that I think sometimes get left out of risk assessments. I think it's important to make sure that you're considering that. Also consider that everyone working in the laboratory has a different skill set, or that their training may be different from others in the lab. Maybe they're new to the lab, or maybe on medication. It could cause some sort of immunocompromise. These and many more considerations are important for including in your risk assessment. And again, I'd recommend checking out that, that risk assessment template as well as the APHL seminar. Next slide. And I think we're about ready to wrap up here. So after the risk assessment, after you do that, and these are the steps, you go from identifying the hazards to assessing those hazards and what the implications are. Then you make the decisions on how to control those hazards. You develop the controls, whether they're administrative or putting into place additional PPE. And then you make sure that that guidance is followed by your laboratory. And then you go back and you supervise. You determine whether the precautions that you put into place make sense, whether you've had any accidents that you didn't foresee or anything like that. You develop and you continually modify things once you know how they're working. And so that's really the overall risk management process. Again, it consists of risk assessment and risk management steps. And really what you're after is, can improvements to the process be made without compromising the safety? Next slide. Okay, so this sort of wraps everything up. Number one, acknowledge that there's risk in everything that we do, and risks and hazards for the work that we do can never really be reduced to zero. Never take too lightly the potential of a biological organism to surprise you or evade your controls due to lack of foresight or someone not following the rules. Don't underestimate the value of good training, and assume that any unknown illness in your laboratory until you know better is a potential laboratory acquired infection. You have to assume that and make sure that you have reporting steps in place to ensure that you don't miss something. Be conservative when dealing with unknowns or unfamiliar agents, meaning take the best steps or the most comprehensive steps that you know of until you can, after you've been working for a while, you may be able to reduce the level of precautions that you're using. But initially start off with the most comprehensive of those. Have a plan to deal with any unrecognized illness. Put procedures in place, whether it's a fever watch or take steps to contact your occupational health program for how to do that. And I would say most important is develop an overall laboratory communication plan. Communication is really the key to safety in the laboratory. Next slide. So the resources that I have listed, WHO, specifically the Laboratory Biosafety Manual, and the technical guidance that has been most recently put out. Transport infectious substances is important to review. Next slide. From CDC, I mentioned the biosafety FAQs, and these are continually being updated. What is in blue are the links to the guidance. Obviously, the black text indicates the title of what you're looking for. I'll mention a few things. ABSA International is the American Biological Safety Association. They have a COVID-19 SARS-CoV-2 toolbox available on their website. It's free to access. And since it is regarding biosafety, it includes the most recent updates to what considerations should be taken into account. They have recently, as of yesterday, I think that they provided additional tools in that toolbox, so check that out. Another thing is the International Federation of Biosafety Associations, IFBA, and unfortunately I did not include the link to that, but IFBA represents all of the biosafety organizations worldwide, and they have some good resources available on their website. And if anyone is interested, please let Anafi know, and I will provide the link to the IFBA site. Africa CDC has been very up to date with recommendations, and I'm providing the link to the Africa CDC resources as well. There is the risk assessment seminar from APHL, again, free, so check that out. Next slide. And with that, I think I'm done. I hope I didn't, I know I went over by quite a bit, but hopefully there's still time for questions, and hopefully we'll be able to get to most of them. Thank you very much.
Thank you very much, Dev, for the wonderful presentation. Ladies and gentlemen, it's time for questions and answers. Quite interesting information that came from the guidance. I remember David saying every etiologic agent is different, every lab is different, and every person is different. We have the guidance. We know we have had challenges, PPE, and all the sort of things that are in short supply. Let's hear from colleagues on the ground. What are the issues? So I'll take the first question, and it's from Mary Ann. She's from the University of the Philippines. Thank you for Mary Ann for joining. She says, do all countries consider SARS-CoV-2 as part of, I guess you wanted to say, risk group 3?
So right now, I think that they're probably still making up their mind, and that comes with additional information. As we all know and are aware of, there's new information coming out every day on research being conducted. This is not a hemorrhagic fever. Hemorrhagic fevers have no treatment other than basically sustainment treatment. So this is not a hemorrhagic fever. And as I mentioned, this is an aerosol-borne, aerosol transmitted disease, but treatment is available, you know, and it's mainly making sure, and for the most part, treatment consists of just, you know, rest and that sort of thing until you can get over it. Now, the problem is that in some cases, in some patients, there are underlying medical issues that may lead to additional complications, and that's the thing, and that's what's being researched now. But for the most part, what we're talking about is an organism that doesn't have right now doesn't have as high of a mortality rate as we, I think, at first thought. And so I think that right now handling this organism, not the organism itself, but samples, can be done safely at BSL-2 with the precautions that we have mentioned. The BSL-3 aspect, again, as I mentioned, until we know more about the pathogenesis and about the characteristics of this organism, I think that culture and basically amplifying virus will still be done at BSL-3. Hope that answers that.
Thank you, Dev. The next question, I think, has been is from Eric, and he says, do we have a customized risk assessment tool in reference to COVID-19, or the normal biosafety checklist by WHO or CDC customized for country case is enough? I think there was a checklist somewhere there. I'll combine that with another question from Emmanuel Cooper. And this is one of the most common questions we've been receiving over time. Is it possible to perform diagnosis of COVID-19 without a biosafety cabinet?
Currently, and that was what I was trying to allude to whenever we were talking about the decentralized and point of care slide. Currently, the aspect of if you do not have a certified biosafety cabinet, that is the recommendation. Having that primary containment along with the infrastructure and supplies that you need, the PPE and a good place to do the work is what is required at this point in time. So you can safely do this work, the work that we would normally be tasked to do at utilizing the things that we're doing currently. So I don't see a problem with it right now. Obviously, as we go forward, we may find out new information and things like that. But currently, I think that yes, you can do the diagnostics for this disease at BSL-2 without a cabinet. Now, whenever I say that, that is the recommendation, to have a cabinet, have a certified biosafety cabinet, class 2. But if you do not have that, additional precautions such as additional PPE, making sure that you have those barriers in place, the face shields, the mucous membrane protection, the eye protection, as well as fluid resistant gowns and hand protection. Now, I didn't mention this specifically, but the biggest thing that you can do is once you're done with doing the diagnostics and you go out of the laboratory or take off your PPE, make sure that you properly do the hand washing. Having soap and water available, having running warm water in a sink, and having soap and paper towels is critically important to preventing spread.
Thank you, Dave. I like such questions. I think they are the practical things on the ground. Next question is from Camille, and he or she says, do you store processed VTM samples, or for how long? Do you pre-treat the VTM before disposal?
That is a question that I do not have an answer for, and I would say that that's probably going to be better addressed by someone who actually is handling or is actually doing those sorts of things right now. I know storage conditions, perhaps what I can do is find that. I think that CDC has published that guidance, and it wasn't right now, it wasn't something that I wanted to get into the weeds with for this presentation, but what I can do is I can try to look for a link that sort of discusses that, and I will forward that to Anafi. Sorry about that.
Thank you. I would also ask if there is anyone currently online right now who is probably testing and would like to share an experience with regards to how they are processing the viral transport media. Please lift your hand and then we can give you an opportunity to respond whilst we take the next question. All right. The next one is, I think you have touched on it, but let me just quickly go through from Rhoda. What biosafety level for COVID-19 and the right PPE and waste management? I think you have touched a bit on that. Again, I'll repeat this for the purpose of just making sure that this is a recurring question. If you are using GeneXpert for COVID-19, what should be the dimensions of your lab? Is it advisable to use GeneXpert for COVID-19 without BSL-2? I think you have responded to it again.
Yeah, and just for clarification, again, and maybe I should actually make the recommendation that if you have or you have colleagues that are doing TB work, they're actually more probably familiar with the aerosol prevention techniques that we've been discussing. So if you have questions, I would refer you to some of your colleagues that do the TB work as well. Now, the GeneXpert issue does not come into play for TB at this point because GTC, guanidinium thiocyanate, is not currently used in the TB what do you call it, the TB cartridge. But for the Cepheld GeneXpert cartridge that is used for SARS-CoV-2, that does contain guanidinium thiocyanate as far as we're aware. And so that's the reasoning for the additional recommendation that those cartridges be destroyed by high temperature incineration. Regarding PPE for waste disposal and things like that, standard precautions, as I mentioned, hand protection is really important. Make sure that you're not mixing any sharps or anything like that into your waste management where it does not, into your waste system where it does not belong. So having good hand protection and wearing proper gloves and other PPE is critically important throughout the process of waste management. Also make sure that your autoclaves are validated, that they reach the proper temperature for sterilization.
Thanks, Dave. I'd like to call upon Khalid Fares. Khalid, I think you'd like to respond.
No, it's okay. It's okay. Thank you.
Okay, go ahead, Khalid.
No, it's okay. Thank you. I did have question a few minutes before, but it's okay now.
All right, thank you. I had called upon.
Thank you.
You're welcome. So Ravi Gunturu, I hope you are responding to the question on VTM. Please go ahead.
Yes.
Go ahead, Ravi.
Yes, I just wanted to share. It depends on what the laboratory is doing, how we dispose of the VTM. If we cannot, we do not want to do any more studies, we can just autoclave, because we autoclave all our biological waste, our culture sensitivity tests, all the subcultures, everything we autoclave before we dispose of. But in case of COVID, we are retaining these samples because we want to do some other studies. So we are freezing them in -80. So what we are doing with the VTM depends on what the lab wants to do. If they don't want any further studies, they just want to safely dispose it off, they better safely autoclave it before disposing of. But if they want to undertake further studies, we can retain them.
Okay, thank you.
That's very helpful.
Thank you very much, Ravi. We appreciate your experience so much. I also have some experiences that have been posted as well regarding the same question. There are two other options. One is vortex and transfer elute into 2 ml cryogenic vials and break the swab. Then store the elute in separate vials, like 600 microliters each. And then the last one can be frozen, or you can then send them directly to the incinerator. What we will do is also try to have these instructions maybe put in writing and also share with the rest of the team that may be interested. Some are also suggesting using that lysis or heat inactivation. So I think we'll get these and probably share together with the rest of the material when we send to you. Let me move on to the next question. We acknowledge there are quite a number that are coming through. I think most of them were talking about the Biosafety Cabinet. A slightly different question is from Anna, and she says, is it advised to do a respirator fit testing at this time? Are the risks not too high?
Bye. Sorry about the interruption. Okay, so if I'm understanding the question, I'm not sure I got it, but is it proper to do a respiratory fit testing at this time? Is that what the question was?
Yeah.
For N95s. If you want to utilize an N95 in your PPE procedures, that is the guidance for utilizing them. A respirator, be it an N95 or any other proper respirator, will not function correctly unless it is fitted to your face. and that means that the seal has to be good, and the only way to determine that is either a qualitative or a quantitative quantitative fit testing. And what they do is they ensure that the seal is proper when they're doing the fit testing, and that you don't have any sort of issues with your facial configurations and things like that. You don't have a beard. Hang on, Josh. If you have a beard or facial hair, there will not be a fit, and so you need to look at other methods of preventing aerosol exposure to your respiratory system.
Thank
so
you.
Yes, I would recommend that if you're wearing N90, want to wear an N95, that you get the respiratory fit testing done. Bye, Josh.
Thank you, and we're also glad to have a second presenter. Yeah. Thanks a lot, Dave. And ladies and gentlemen, it's at the top of the hour. We acknowledge the questions that are coming through, and as usual, I think we will get all of these coming through. I must say we now have, I think, almost nearly 80% of all the responses from previous sessions that we should be posting anytime soon. Again, I think I would like to thank all of you from all over the continent and beyond. I could see people who are actually in the lab right now, taking time to listen.
Great.
And I hope all this has been very, very helpful. Thank you very much for this. Until we win this fight against COVID-19, we shall continue to soldier on. Tomorrow, we have also an interesting session at the same time lined up. We are doing part 2 of the serology diagnostics. As you realize, we had so many questions in part 1, but tomorrow we are looking at performance issues, which is actually a key area of discussion that we have right now. Till we meet tomorrow, thank you and goodbye.